Good afternoon, everyone. This is Sarah Arkin, your clinical pharmacist. So, what is Xpovio or Selinexor? Xpovio is from Cario Farm Therapeutics, FDA approved in 2020. This medication is a nuclear export inhibitor indicated in combination with bortezomib and dexamethasone for treatment of adult patients with multiple myeloma who have received at least one prior therapy, and also in combination with dexamethasone for treatment of adult patients with relapse or refractory multiple myeloma who have received at least four prior therapies and whose disease is refractory or at least two proteases refractory to at least two proteases inhibitors, at least two immunomodulatory agents, and an anti-CD38 monoclonal antibody. Also, for treatment of adult patients with relapse or refractory diffuse large B cell lymphoma, not otherwise specified, including DLBCL arising from follicular lymphoma after at least two lines of systemic therapy. In non-clinical studies, Selinexor reversibly inhibited the nuclear export of tumor suppressor proteins, growth regulators, and mRNA of oncogenic proteins by blocking the X protein XPO1. XPO1 inhibition by selinexor leads to the accumulation of the TSPs in the nucleus and reduction in several oncoproteins. It comes in tablet format of 20 milligram for administration. Its recommended dose is 100 milligram taken orally once weekly in combination with bortezomib and dexamethasone. For multiple myeloma in combination with dexamethasone, recommended dosage is 80 milligram taken orally on days 1 and 3 of each week in combination with dexamethasone. And lastly, for DLBCL or diffuse large B cell lymphoma, recommended dosage is 60 milligram taken daily on days 1 and day 3 of each week. Most common side effects seen from Xpovio include upper respiratory tract infections, decreased weight, cataract, and vomiting. Again, this is a summary information about Xpovio or Selinexor from Karyopharm Therapeutics for treatment of multiple myeloma. For more detailed information on this drug, refer back to the package insert that will give you more detailed and specific information on the dosing, cautions, and precautions. Hope you enjoyed this video. As always, stay safe and take your medications.